see that you've already disrobed and put on a gown. I'm just going to wash my hands and then close the curtain for privacy. On first appearance, Lindsay appears to be her stated age and without any physical disformities. She's alert and oriented, and her responds appropriately to all questions asked. Her affect is appropriate for her stated mood, and she overall maintains very good eye contact. Her gait was smooth and coordinated. I noticed that when she walked in, she didn't use any assistive devices, and her range of motion was intact with no involuntary movements. Her posture is, she sits comfortably and erect for her age while sitting on the table, and with her arms to the side on her lap, and her facial expression is relaxed and appropriate. Just from observation, her skin is like a light tan, and it appears to be even throughout her body, with no obvious lesions on her face, her neck, arms, or lower legs and feet. Her weight is appropriate for her age, and her clothing that I saw when she came in was also appropriate for the season. She was neat and she's clean. Her native language is English, and she's articulate and demonstrated that she can hear well and respond appropriately to all of my questions. Lindsay, I'm going to ask that you come with me over to the scale so that I can take your weight and measure your height. And just hold your down, please. Lindsay's weight is 135 pounds. Now I'm going to ask that you step on here one more time while I measure your height. Turn around, please. With your heels back as far as you can take them. Thank you. Okay. I'm going to give you a hand while you step down, please. All right. Lindsay is 5'7" tall. And we can go back to the table. I'm sorry. Back here. Put your heels on the line. I'm going to get a card, and I want you to cover one eye, and I want you to read line number 7.
FELOPZD.
Okay. Can you please read line number 8?
DEFPOTEC.
And now can you read line number 9?
LEFODPCT.
Okay, can you cover the other eye, please? And now can you read line number 8?
DEFOTEC.
And now can you read line number 9?
LEFODPCT.
Okay, can you take the card down and read with both eyes? Can you read line number 8?
DEFPOTEC.
And can you try to read line number 9?
LEFODPCT.
Okay. Lindsay has 20/20 vision. Can you sit back on the table for me, please? In both eyes. Upon examining Lindsay's skin, her skin is light tan and it's even consistency throughout, smooth and moisturized with no obvious lesions. Her nails are short and round and clean, and her capillary refill is less than 2 seconds. I'm going to loosen your gown a little bit, Lindsay, right here. Okay, can you hunch your shoulders over a little bit? All right, her turgor is good and skin is resilient. All right, Lindsay, now I'm going to take your vital signs. Using an adult-sized cup. Lindsay's palpable pulse is about 110. I'm going to leave this on your arm just for about a minute while I take your temperature. Have you had anything to eat or drink lately?
No, I haven't.
Recently, excuse me?
No.
Okay. Under your tongue, please. Lindsay's temperature is 98.5. All right, I'm going to take your pulse. Lindsay's pulse is 80. The rate and rhythm are regular. Her pulse was about a +2, and her respirations were 14, and those were regular as well. Now, Lindsay, I'm going to take your blood pressure. Lindsay's blood pressure was 116/62. Thank you. All right. Just going to inspect your head and your face right now. Lindsay's hair appears to be smooth in texture. It's light brown, and it's that color pretty much throughout. Her head is normal cephalic with no protrusions. Is there any tenderness when I touch your head, Lindsay?
No.
Okay. And there doesn't appear to be any infestations or any lesions. All right. Lindsay's face is slightly pink. Her eyes are symmetrical, and let's see. Her facial expression seems to be relaxed, and her facial mobility is smooth. Okay. I'm going to ask you to smile for me. Okay. Now wrinkle your forehead. Okay. And now I want you to puff out your cheeks. Very good. Cranial nerve number 7 is intact. Okay. I'm just going to feel your sinuses and let me know if you feel any pain or pressure or tenderness. There?
No.
Any tenderness?
No.
Okay, very good. Lindsay states that she feels no tenderness when I palpated her sinuses. Okay, I'm going to ask that you clench your jaw really tight for me, please. Is there any pain or tenderness when you do that?
No.
Okay, now I want you to close your teeth really tightly, and I'm going to pressure, try and pull open your jaw. Very good. All right. Any pain or tenderness when I do that? Very good. Lindsay says there's no pain or tenderness with her jaw when I try to pull it. Cranial nerve number 5 is intact. Okay. I'm going to ask you to close your eyes, and I'm going to lightly touch your face in different spots, and I want you to let me know when you feel it. Okay. Close your eyes now, please. No. Okay. Cranial nerve number 5 is intact. Okay. symmetrical, as well as your eyelashes appear to seem full and your eyes are symmetrical as well. I'm going to touch your face, your eye, around the eye section. You just let me know if you feel any. Lindsay's conjunctivae is pink. And then put your eyes from the side. Lindsay's sclera is clear. Cornea is clear, excuse me. Okay, I want you to look directly at me. And just focus on me. All right, let's see, Lindsay's pupils were consensual. And now I'm going to measure the size of your pupils. Size of Lindsay's pupil is a 4, the shape is round. Okay, Lindsay, just look at me. Lindsay's eyes react to light and accommodate with consensual response. Lindsay, I'm going to ask that you follow my finger with your eyes. Lindsay's eyes move symmetrically with no nystagmus. Her corneal light reflex is symmetrical as well, with no extraocular movements. Cranial nerves 3, 4, and 6 are intact. Lindsay, I'm going to give you this card, and I want you to cover one eye. And when you do that, I'm going to wiggle my fingers from various positions, and I want you to tell me the first time that you see them, okay? Okay. All right, cover one eye, please.
No. 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 No.
Okay, now switch eyes for me, please.
No. 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 No.
All right, thank you very much. Lindsay's visual fields are full by confrontation, and cranial nerve number 2 is intact. Now I'm going to give you this card again. I'm going to ask that you cover one eye, and I want you to just read the first line in this paragraph and hold it about waist high. So cover one eye, and I want you to read that first line.
Card is held in good light 14 inches from eye.
Okay, now switch eyes please and read that line.
Card is held in good light 14 inches from eye.
Okay, Lindsay's near vision is intact and she can read without difficulty. So her near vision is 14, 14. Okay, I'm going to now inspect Lindsay's ears. Just want to get your hair back a little bit. Thank you. All right. Lindsay's ears